Check out the link in description box below to win the new iPhone 11 Pro.
Health chiefs apologize for death of great-grandfather left in hospital without any food or water. Health bosses have apologized over the death of an 80-year-old patient who was left without any food and water. Malcolm Pinches, 80, died at Walsall Manor Hospital, West Midlands on June 13 this year, and an investigation has now revealed failings in his care. It found that nurses did not recognize the importance of hydration, while food charts were not filled, in meaning it wasn't known whether or not he had eaten. Mr. Pinch's daughter Tina Noon said he was left without any dignity as he deteriorated at the hospital. Mrs. Noon, from Walsall, told how she was forced to feed her father herself on one occasion, while he was placed in a side room on his own, despite having suffered a fall and cutting his head during his stay at the hospital. Mr. Pinches, from Pelsall, Est Midlands, fixed engines at Lucas Aerospace in Wolverhampton before retirement, and was also a keen member of Wolverhampton Slot Car Club. He was placed on discharge wards when Mrs. Noon said it was clear he was not well enough to go home. She said she believed nurses wanted to get him out of the hospital. Richard Beacon, chief executive of the Walsall Healthcare NHS Trust, which runs the manor, said he was very sorry you had to feed your father and encourage him to drink because you felt nursing staff were uncaring and not doing their job properly. Mr. Pinches had been on a drip, but the cannula came out, he explained. This does not portray a good example of the expected standard of care to be delivered by our staff. There was also confusion about whether or not the pensioner had suffered a mini-stroke before arriving at hospital on May 27. Mrs. Noon said the GP who responded to a 111 call believed he had had a mini-stroke, but doctors said there was no mention of this in Mr. Pinch's medical notes. His condition deteriorated and Mr. Pinches died on June 13 this year. An investigation by the trust listed inconsistency of documenting food diary input and output, not recognizing when an individual requires more help with their meals and not recognizing the importance of hydration as failings in Mr. Pinch's care, and has pledged to improve. But Mrs. Noon, 57, said, "The dignity that was lost was beyond belief. He was being passed from discharge ward to discharge ward when he was getting progressively worse. What the hell was going on? They were just trying to get him out." She added, "The apology means diddly squat. Don't be really sorry, change things." Karen Dunderdale, director of nursing at the trust, said, "We have thoroughly investigated the complaint that was made and have apologized for our care falling below the standard we would expect in some areas. We continually work with our patients and their families to ensure improvements are made to help us deliver safe, high-quality care, and have offered to meet with Mr. Pinch's family, which has been accepted in order to further address their concerns."
Check out the link in description box below to win the new iPhone 11 Pro.